Hey, homies, what's up? So today, I got a very, very, very important question for most of you. Or a lot of you. You know what? Everyone gets a question. Everyone gets answers. I want everyone's response down in the comment section below, right? Would you rather have a limp noodle, but you get to keep your eyesight? Or would you rather be blind to the world, but that thing on point, just bang, just like 48 hours of just stiffness, 2 weeks hard on demand, right? You just breaking bricks with your strong, just bam, 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 out here knocking home runs with that thing. It's so hard. Yeah, let's talk about it. Hey, homies. So many men take erectile dysfunction meds. You know what I'm talking about, the blue stuff. The little blue choo-choo, the little pa-pa-pa. It look like blue Skittles, but it gets you to the moon. Most men, most of the time, can take these drugs or these medications without any kind of complications or issues, right? A report from 2020 describes 17 cases where men develop persistent vision problems after taking ED meds, which include blurred vision, heightened light sensitivity, reduced eyesight, and an odd phenomenon known as synopsia. I'm not really sure how to say it, so we're just going to say what feels better in my mouth. Just so we're clear, we hear everything for the first time at the same time. Don't judge me. I did, whatever. Synopsia, where vision appears intensely blue. So imagine just walking around with a blue tint on life. I'm gonna say like a happy-go-lucky tint, and I don't mean blue as in like you're just sad. I mean blue like there's a blue dim, I guess, yeah, just tinted. Some also experience red-green colored blindness, right? So they're just flipping around the colors, looking at Starbucks, looking at rainbows all confused, not knowing which Skittles they're really eating. Typically, a lot of these side effects occur for new users, and, well, they're typically temporary. Typically only lasting a few hours, maybe a day or two. However, these 17 men experienced prolonged symptoms lasting up to 21 days. That means for 3 weeks they were walking around probably happy in the wood department, but just not really happy in like the visual cue, looking at signs, understanding what, just like, damn, this is really blurry. I think I might need more glasses. Nah, not really. You just need to soften up a bit and just accept it. It's emphasized in this report that such effects are rare, but may be more likely in individuals who take high doses without medical supervision. So always follow your prescription guidelines. That's important. Experts recommend starting with the lower dose and seeking medical advice when using ED meds in order to mitigate these risks. And it's important to note that all the men in this report were first-time users who all started at the highest recommended dosage of 100 milligrams. So, they were supposed to start at 50, they stopped. Twice as nice. Make my wife happy. And now they can't see, at least for 3 weeks. It came back after 3 weeks, right? These medications treat ED by inhibiting an enzyme which plays a role in regulating blood flow to the pee-pee, the penis, the stick in the balls, the pogo stick. However, they also inhibit a related enzyme which is found in the retinal cells, right? So the light sensitive cells in the back of the eye. Therefore, the hypothesis is that in high doses, the inhibition leads to buildup of a molecule that might be toxic to the retinal cells in your eyes. So you can't see as well. Just wandering around during the daytime, like you're wandering around at night. But you have a little thingy thing, and just let that hit. It's kind of like a blind man's pole. Just point your penis due north. You be alright. We're not done yet because as the saying goes, bigger isn't always better. And that's also true with ED meds. Because in 2019, researchers in Massachusetts reported a case of a man who developed vision loss, including donut-shaped spots in his vision, which lasted 2 months after he consumed an entire bottle of the blue stuff. That means he was like, oh, I should take a little bit, just throwing back the blue chew, just blah, blah, blah. Like it was tequila at a bar. Like he was just going adios MFs all day. Like he really wanted to sippy sip and like have his thingy drippy drip all day. Like he just, bad. The man who was in his mid-50s drank 30 milliliters of the bottle of liquid of the blue stuff at once, meaning he threw back 750 milligrams of ED meds, about 10 times the recommended dose, according to this report. And just like the last story, eye problems began soon after. After 2 months, the man decided, like, hey, this might be a problem. I can't really see. Like, I'm performing in bed, but I can't really, like, you know, admire my work or just take credit or be like, I did that because she over there. But he thinks she over here. He dry humping pillows. He think he's getting it in. Nah, that's just a sweaty sock. Yeah, let's go with that. Right? So now he has donut vision. I guess nut vision or don't nut vision. And a blue tint in order to match his probably blue balls at this point, really. Tests showed that the man had problems with his retinal cells, as we discussed with the last article. It kind of be like that sometimes, especially if you just being irresponsible with your dosage. Unfortunately, there is no treatment for this condition, and the patient didn't follow up for a return appointment. He never returned for a follow-up appointment. So they don't really know if it got better, if it went away, if it got worse, if he started seeing crystals in the sky, if he could see through rainbows. No one knows. And obviously, this is not the first time this has happened. Something similar happened in 2012 when doctors in the United Kingdom reported the case of a man who experienced vision blurring, also due to retinal abnormalities after consuming 1,500 milligrams of the blue stuff. I think the last story said 500. 500 is like the recommended starting point. And those guys took 100. They were like, nah, we'll just double up. I'm twice as hard as the next guy. I mean, you are now, really, when you think about it. Twice as hard as the next guy. This guy was like, hold my beer and my penis. Bam! 1,500 mgs right out the door. Let's get it, right? In October of 2018, additionally, doctors in New York described the case of a man who developed a red tint in his vision after drinking a bottle of meds. He was just seeing red, and you know, he took a lot of blue, sees a lot of red. I don't even know if you could pee comfortably at that point, really. Let me know down below if you've used the blue stuff. Can you, how long would it take for you to call your doctor? Would you be like, I haven't seen straight in 3 days, like it's time now? Or would you hold out for the 2-month period? Would you be like, I'm a king of kings, I'm gonna wait it out 6 months if my vision doesn't come back? I'm down, I'll go to the hospital. What would y'all do? Right? But once again, these are also rare cases. In rare cases, people who take ED meds reported a different eyesight effect, which was non-arteremic anterior ischemic optic neuropathy, which we spoke about in a previous video, which is why I made this video, because that video reminded me of ED meds and retinal detachment, which we'll get to, kind of, probably. We'll see. Which causes, however, non-arteric anterior ischemic optic neuropathy causes sudden loss of vision due to the loss of blood flow to the optic nerve, right? It's kind of like when you're growing up and you're like, hey, you gotta think with the big head, make sure the flow's going to the right head, because like, yeah. It's more than just your thoughts. You gotta be careful with your eyes, right? You need to make sure your brain and your eyes get the proper blood flow so everything's working. You're not just walking into doors with a hard woody. However, in this report, it's unclear if the medication actually causes this condition or if people who take ED meds are more likely to have other risk factors for this condition. In the current case, tests show the man did not have this condition, which I can't pronounce. And last but not least, we got one more study, because a study in 2022 from the University of British Columbia revealed a significant association between regular users of the blue stuff for little beep, you know, up and at them, and vision-related health problems. The study examined insurance records of 213,000 men in the U.S. who had not previously experienced eye conditions before starting their ED treatment. Yeah, I can't think of anything for that. Yeah, ED treatment. It found that the users were 2.58 times more likely to develop serous retinal detachment, 1.44 times more likely to develop retinal vascular occlusion, and 2.02 more times more likely to develop ischemic optic neuropathy. That word's just going to keep coming for me. That's weird. Compared to non-users. So the study doesn't prove causation. It just suggests very, very strongly a possible link related between the medications that affect blood flow to your little man to help make your flag stand at attention and eyesight. Researchers emphasize the importance of patients monitoring their vision and seeking medical attention if changes occur, advocating for improved patient education on potential risks. Because currently, the only real warning is like, if your erection lasts more than 4 hours, call your doctor. It should be like, hey, if you go, yay, but you look up and you can't see nothing, call your doctor, right? If you open your eyes and it looks like a blurry windshield, call your doctor. If you open your eyes and everything's either tinted red, yellow, blue, green, or any other color, basically, if your eyes aren't seeing as they used to, yeah, there you go. If your eyes aren't seeing as they used to, even though now you're performing like a 24-year-old, call your doctor. Anything goes wrong, call your doctor. You didn't get these meds legally, and now you're having issues. You should still call a doctor. So basically, the question I have for you guys and gals is, would you rather be up and at 'em, at attention, on command, on duty for whenever you need it? Or would you rather keep your eyesight? Obviously, as stated, it's not necessarily a 1-for-1. There's no guarantee. You just have a slight elevated risk. And I mean, LASIK's always there, and I don't really even use my eyes, do I? Yeah, I guess I do. Right now. But I don't know if Grandpa uses his eyes, right? Because he don't really need to see anything, but he still got a wife. What y'all think? Let me know in the comments below. Peace. Blue choo-choo, the little pa-pa-pa. It look like blue Skittles, but it gets you to the moon from here to there. Right? Help you and your girl or your boy, whatever. Go pogo stick, round and round all the way till everyone is happy. It's like Santa Claus giving out sugar canes. Candy canes? You keeping Mrs. Claus happy. Anyways, most men, most of the time, can take these drugs or these medications without any kind of complications or issues. But sometimes, right, you already know, right, if it persists for more than 4 hours, contact your doctor. But how many of you are aware that some of the times these medical complications relate to eyesight? That's right. You're going to be hard all day, but you might be blind as night. You'll be like, yeah, but you won't be able to see anything. Right? So you'll definitely be like old man Grandpa just walking through the kitchen with the big stiff woody, just knocking everything down. And your wife's going to be like, hey, Cletus, you knocked over my good plates again. And you're going to be like, I'm hard. Hard as a broom handle. But you got to take the good with the bad with the good, the blind with the wood. Or would you keep the wood? Wait. Or would you keep your eyesight? What would you prefer? Real, that's actually the question. Right? Would you rather be stiff, with no vision, or have vision and be limp? Probably. Hey, homies, what's up? So today, I got a very, very, very important question for most of you. Or a lot of you. You know what? Everyone gets a question. Everyone gets the answers. I want everyone's response down in the comment section below. Right? Would you rather have a limp noodle, but you get to keep your eyesight? Or would you rather be blind to the world, but that thing on point, just bang, just like 48 hours of just stiffness, 2 weeks hard on demand, right? You just breaking bricks with your strong, just bam, 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 out here knocking home runs with that thing. It's so hard. Yeah, let's talk about it.